Welcome to Sound Health on Lagos Television. I am Olasunbo Mudbe. We bring you sound health every Tuesday and we try to highlight trending health issues from around the world. Today on the program, we are taking a look at chest pain, medically known as angina pectoris. Oftentimes, many people complain about chest pain as a result of lifting heavy objects and other daily activities. This is our focus, and our guest is on standby. You get to meet her after this break. Please stay tuned. The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Abiola Ayilara, founder and lead nurse at My Care Assistant Limited, and she is going to tell us what are the root causes of angina pectoris. Good evening, Abiola, and thanks for joining us.
Good evening. How are you doing today?
I am fine.
I'm happy to be here with you.
All right. All right, oftentimes many people complain about chest pain. Tell us, what exactly is the cause of chest pain in people, also known as angina?
Angina is, you mentioned, the type of chest pain, and it could be as a result of reduced blood flow to the heart muscle. Now, chest pain comes in different types of, conditions, but for the record of this conversation, I'm thinking that you're looking at maybe why people have chest pain, right? So,
yes,
like I said, it is a type of chest pain. It could be as a result of reduced blood flow to the heart muscle, and it's sometimes a symptom of maybe a coronary artery disease.
Okay, what could have been the cause of this chest pain? Can it be sudden or as a result of some regular activity experienced by such person?
All right, so when it comes angina or chest pain, as you put it, there are different things that could cause it, right? So maybe the person's lifestyle choices, maybe when they're eating, or if they're smoking, or maybe they do like vigorous exercises. These are common causes or attributes that you get to know about when people complain about chest pain. For some people, it could be sudden, and for some people, it could be insidious, right? And most of the time, it could necessarily not be sudden. It could be that something has actually been going on underneath that the person is not aware about. And maybe by virtue of exercise or lifting something, they begin to feel that pain in their chest wall. And again, it could be attributed to several things. Some people will have chest pain that is due to maybe they have an ulcer or an esophageal reflux, or they have a pain maybe in their gallbladder, especially with adults. So it is very important that the real cause, the root cause, is identified by the physician.
Okay, earlier in your response, in your introduction, you mentioned heart-related disease. Is this life-threatening? When should a patient or a person should be worried about these symptoms?
Okay, the moment a patient or someone, an individual, experience chest pain, I think it is important for them to visit their doctor as soon as possible, because it is better for you to treat something that is just starting than when it has really gone worse. So there is what we call ischemic attack, and then there is failure. Ischemic attack, it could just be that there is a temporary, maybe it's just an insidious viral death or degradation of the heart muscle. At that point, when it is picked on time, it can be managed. The patient can be given some medications that would help to test that ischemia. But in the case where it has now led to maybe a total blockage of the heart, of the arteries, leading to the death of the heart muscle, that means it's a heart attack that is impending if it has not even happened. At that point, people will now begin to consider interventions like maybe a stent or an angioplasty to repair the artery that has been blocked.
Okay, apart from chest pain, are there other symptoms, signs a person must have been experiencing and ignoring? And have you also seen cases where a person does not smoke or engage in any sedentary lifestyle and end up with this condition?
Yes, but like I said, angina is just a symptom of any underlying problem, right? So we probably see many people come to the hospital complaining of pain. Do you know that at some point a client may come to the hospital complaining of chest pain, and we would check all of the things. Maybe we'll do a stress test on the treadmill, we'll check the ECG, they do all of these tests, and there'll be nothing picked by the scan. And it could be that, the big arteries have been also assessed. There was nothing picked. Sometimes we kind of miss the diagnosis. If it is the tiny arteries that are affected, at this point, if eventually it's being picked up on, it can be properly managed. On the other hand, it may not necessarily have anything to do even with the heart. It could just be that this person has maybe an onset of an ulcer that is coming up, and that is causing them to have maybe an associated chest pain. It could be that the esophagus is inflamed or there is spasm over there, and that could also lead to chest pain. It could be an elderly person, maybe in their 60s, that has got maybe gallstones, and that pain is right in their chest. It's very important that the diagnosis is made on time to rule out any anomalies.
All right. Prevention, they say, is better than cure. Could this condition, yes, result to any other complications aside from a possible heart attack or heart disease?
So, like I said, if it is a heart problem that is causing the chest pain, it is important that it is observed, because if it isn't, it can lead to heart failure. Okay? But if it is not a heart-related condition, once it's been identified that it is due to any other differential diagnosis like an ulcer or a gallstone and things like that, once those underlying causes have been treated, then the patient is able and good to go, and the patient is educated on living a quality healthy lifestyle.
All right. Is this condition treatable?
It is treatable. I mean, once a patient complains of a chest pain and they go to the hospital and they realize that it has something to do with the heart, the doctor is going to recommend some medications. Most of the time, they would recommend a nitroglycerin, but then all this medication has to be well monitored by the physician and even the health care organization managing that client. I don't think it is wise for any patient to say they want to manage a chest pain by themselves. So far, it has something to do with the heart. But if it is that somebody lifts maybe a heavy object, or they weight, or maybe they have, physical exertion that led to that chest pain, ideally would recommend rest for such people.
Okay. Have we seen women come more often to the hospital to complain about this condition than men?
You see, when it comes to prevalence of angina, I think with the current data, which is not Nigerian data, by the way, 3 to 6% of women would have an angina, while 47% of men would have it. So we definitely have like relatively about the same ratio of men to women experiencing this condition, but it is mostly picked up in men.
In men, is there a reason behind this data?
I wouldn't, well, it could be maybe the nature of the job, the lifestyle choices. There's so many variables that we can consider. It could be as a result of the socioeconomic, conditions, many things that we can actually consider to be factors that can contribute to why there's more men than female.
Okay, so Abiola, tell us, how do you prevent angina both in men and women?
I think the best thing to do is, first of all, know your numbers. Know your numbers. Do your check your blood pressure regularly. If the patient has maybe a diabetes, make sure that it's well controlled and managed. Stress very well. I mean, we can't even overstress that. Adjust your lifestyle. What are you eating? What are those kind of foods? Then also know your cholesterol levels. These are very, very important. Once we know all of this, it's preventable. It is preventive than curative.
Okay, can we also look at sedentary lifestyle? Since this condition is one of the symptoms, not a disease on its own now. Let us look at lifestyle. Can lifestyle also contribute to this, apart from smoking and
yes, like
diet?
I said. So somebody that has maybe an unhealthy eating habits will be at risk. Someone who doesn't exercise regularly will be at risk. And this exercise is actually very tricky because sometimes it's during exercise that patients pick up that they have a chest pain. And then they will now be advised on the modalities around their physical activities, right? Again, stress can be a factor. So these things are lifestyle issues, right? Including smoking. If we are able to do a reverse psychology on this, lifestyle choices that we are exposed to, it is possible for us to prevent maybe an angina or chest pain that is related to heart condition now.
Okay, tell us your call to action as we wrap up now, or you have any other thing you would like to add or let viewers at home learn from this conversation.
Thank you. So I would say that prevention is better than cure. If you're smoking, you need to quit smoking. You need to involve in eating a balanced meal. Eat your vegetables, your protein, moderate fats, and also your vitamins. Very, very important. Exercise regularly. If you don't have a regimen, make sure to see your physician to let you know.
And how do you want viewers at home to ensure they get adequate balanced diet?
Yeah, I think it's ideal for people to have a thought plan on what they want to do in terms of food provision. So I think it is easy for us to make adjustments. We just need to now do more work, right, in terms of, okay, what is important to me? What is priority? I think with this, people will not eat unnecessarily very much. So if there's somebody that likes to snack on maybe shawarma, I'm just saying things like that, not necessarily shawarma, or you just want to take other things that may not be healthy, you can just decide that, I'll do this thing at home. Some people like to go to the restaurant to eat. Maybe they cannot begin to consider cooking at home. Also, some people may not like some type of food. It's good for them to consider seasonal food, that are very affordable. And truly, things are not that expensive. I mean, I'm quote and unquote, right? It's kind of relative. But it's very important that people just make adjustments as much as they can regarding what they do.
All right, your call to action now as we wrap up this segment.
So my call to action would be that it is important for people to maintain a healthy diet. It's very important for them to consider eating more veggies, more protein, less fats and oils, a balance of everything. Too much of everything is bad. exercise moderately, especially if you have a history of heart problems. If you don't, exercise moderately. Manage stress effectively. I encourage people to sleep as much as they, 6 to 8 hours of the day shouldn't be not too bad. If they can, I'm not going to say that I'm oblivious to what the economy is saying or the environment that we are in, but at the same time, we want to prioritize ourselves so that we can be longer.
Founder, all right, and nurse. All right, Abiola Ayilara, founder and lead nurse, My Care Assistant Limited. Thank you so much for your expertise on angina, also known as chest pain.
Thank you very much for having me. Bye.
You are most welcome. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. More to come in a moment. Well, this is where we say thank you on today's episode of Sound Health. Hope you've learned one or two things about angina, also known as chest pain. It is a sign of a heart disease. Please do not relent to go to your nearest health facility if you're experiencing chest pain. For comments and inquiries, or you have topics you'd like us to treat, please send SMS 00358 to 6603 or follow us on social media at Lagos Television #Sound Health. A sound health is a sound mind. Make healthy living your choice.